Bismillahirrahmanirrahim. First of all, I would like to thank the organizers of Muslim Mental Health Conference who has given me the opportunity to speak on spiritual wisdom and mental health, rediscovering transpersonal psychology. In this talk, I would like to mention some few points which I would need to explain in a bit detail. The first one is the dichotomy between spirituality and religion. Second would be pharmaceutical therapeutic hegemony and alternative medicine. And the third one is the contemplation and review of spiritual wisdom. And the fourth one is the melodies of the nerves instead of psychiatric disorders. But here I will also would like to add that some people using spiritual diseases, but I am not using spiritual diseases. I use the melodies of the nerves, which mean review of the nerves instead of psychiatric disorder. And then we will conclude. For many centuries, the understanding of religion and spirituality have been found debatable. Spirituality was contemplated or has been contemplated as a personal pursuit or association to the celestial, either within or outside of the formal religion. While religion believed as an organized system of beliefs and practices, allied with an institutional structure. This dichotomy made them distant from each other, I mean the spirituality and the religion. And spirituality was found more concerned with direct experience of latent higher consciousness with oneself or without the influence of established religious guidelines and practices. This unendorsed journey by the religious institutions sometimes led the individual to become the spiritual masters, having his or her own doctrine based on his or her own personal experience. On the other hand, the individual who followed the institutionalized religion without internalized relationship between the individuals and the divine or between the individual and Allah subhanahu wa ta'ala have lost personal wholeness. And these religious practices become or remain routine rituals due to the spiritual bankruptcy. We call spiritual bankruptcy because they are practicing, but that become the routine activities. In this talk, I would like you and myself to rediscover the association of religion and spirituality in the domain of transpersonal psychology and also to restore this integration between spirituality and religion to alleviate the emotional suffering as a consequence of this estrangement or this separation. It is the time to renew the convergence between spirituality and religion and go beyond conventional personal or individual levels. We should look at the experiences in which the sense of identity or self extends beyond individual and incorporate the wider aspects of humankind, life, or psyche, cosmos grounded in religious teaching. In this discourse, I take spirituality as a common factor of faith grounded in the revealed religious sets of beliefs, tradition, practices, community-based worship, and guidelines. Subsequently, spirituality could be acknowledged as a belief in all-powerful force called Allah, in English we call God, who controls and runs the universe the seen and the unseen, and the destiny of human beings and obedience to Him, the All Merciful. In this talk, spirituality will be discussed in the context of Islamic teachings and doctrines, which leads us to the fact that Islam, as a revealed religion, institutionalized its teaching and practices together. Theoretical knowledge may connect the individual to Allah through direct experiences guided by the last Prophet Muhammad, peace be upon him. Traditionally, religion and spirituality were ignored in the last century and weren't taken seriously for scientific discourse because of the reason that faith was highly politicized, while religion and science were aligned in direct opposition. Consequently, spiritual experiences were contemplated illusory. However, now a paradigm shift has been noticed, particularly in the Western culture, which is reshaping its materialist, positivist, and empiricist understanding towards a naturalistic view. A view that recognizes the meaning of personal experiences, emotions, and extra sensory experiences that can't be explained purely in the domain of physical science. De-radicalization and decolonization of knowledge in the Western culture open doors for the discussion to integrate religion and spirituality. Consequently, spirituality and religious practices and states of consciousness are becoming part of the mainstream learning and research in the mental health care system and transpersonal psychology. Considering mental health, here our discourse is around biopsychosocial spiritual model to address the spiritual ailments. But by spiritual ailments, I won't use these words. I just for the explanation, I would use melodies of the nafs, uyub of the nafs, and ailments of the nafs. Uh, for the ruh, I use soul in this, and I won't use the spirit. Usually, the people use spirit for the ruh, but for the ruh, I will use the English word soul because spirit is also used for some other entity as well in the discussion or in different texts. Discussing the melodies of the nafs, it is vital to look at the historical association of religion, medicine, and spirituality through the lens of ethic and emic perspective, which brings us to the point that historically the treatment of bodily and psychological ailments was assigned to religious experts because the medical knowledge and techniques frequently emerged from religious background. And it was impossible to disentangle spirituality, medicine, and religion. This has enriched the recognition of religion as an important social institution and somehow makes it an alternative to medicine or psychotherapy. Speaking about general medicinal treatment such as acupuncture, hijama, shamanic healing, massage therapy, therapies grounded in Islamic teaching, prayers, and faith healings are seen working for most. Modern research too has proved the faith and prayers are effective in mental health treatment in many parts of the world. For instance, like mindfulness for uncontrolled anger and some schema focused therapy was integrated to the Islamic teaching and was found very effective. I would like to say this to mention here, this is very important, that individuals suffering from mental disability, their lives are largely controlled by mental health institutions or professionals which have made them distant from their religion, which thereby I believe that each patient must be treated differently, keeping in mind their religious background and past experiences. Moreover, there are many survivors or individuals with psychiatric disorders who have adopted spiritual enlightenment of their experiences and the contentment of associating with spiritual community of their choice in order to live with meaningful purpose of life and to become a decent human being rather than to adopt forceful way of a boring and tedious recovery. On the other hand, having a higher purpose of life and hope of temporal discounting may make a huge difference in individuals' willingness to bear pain, to work hard, and to learn tolerance in the form of sabr perseverance. However, there are few challenges in adopting spiritual approaches, mental health recovery to confront the current regimen and prevailing norms grounded in therapeutic hegemony, which are based on the fundamental proposition that physical world is real and the non-physical world is illusory. Now, the point here is that how should a practitioner respond to such a situation? Both clients and practitioners are therefore needed to and should have integrated therapeutic insight and degree of comfort in understanding mental health issues in the context of religious and spiritual perspective. What is important is that during initial assessment, the focus should not be just on to discover the deficit, but to gather information regarding religious and spiritual beliefs, practices, and inspiration, community influence, and any past experience, either positive or negative, that could affect their psychological and spiritual lives without any reaction if that may appear bizarre to the practitioner. Practitioner may also acknowledge the client explanatory framework to build rapport and trust and working from the client's frame of orientation, which may increase their adherence to the treatment plan. First, the cultural diversity and religious competency, and second, understanding of self, that is, nafs in the conformity with fitra and uncovering of fitra in the light of Islamic teaching, and contemplation on the uncontrolled lower self, that is, al-amara, which results in a range of melodies, the melodies of the nafs. In Islamic teaching, it is believed that Allah granted human ruh. We can look at this diagram, which we call soul, and nafs or self. The ruh is person's celestial essence beyond the emotions and instinct shared by human and other animals and exists in the form of divine light. The ruh drives to govern the nafs, which contain temporal desire of dunya or worldly and sensory perception. However, nafs can assume the control of body if the divine light or the light which is coming from the ruh is disrupted by bodily urges. And the nafs is subject to bodily urges, particularly the lower nafs, ammara, and shaitan has an access to the lower part of the self. Now, in this way, the lower self is dominant. Then there is in this model, the center is the qalb, divine light coming to the qalb, and then that push Satan and bring light to the or power to the qalb. But when the lower part of the self, or that is nafs ammara, with that take over through the black spots, and then that become black, and the divine light cannot be passed. Then the person become the slave of the lower self and act according to the demands of the lower self. In this way, we need to activate the nafs lawwama, which almost all the time trying to clean these dots, black spots, and make the qalb transparent. For this purpose, I mentioned the Tawbah, Astaghfar, Taqwa, and Ibadah, that is part of the Tazkiya, important for the cleaning of the qalb. Once they clean the qalb, and this should be a continuous activities of the nafs lawwama. In the therapeutic model, the therapist or practitioner need to keep nafs lawwama active all the time. Once they clean the qalb, then there is another stage which we reach to sabr and shukr and then Radha Ilahi, that is Nasr Mutmainna, and that goes to the Fitra Allah subhanahu wa ta'ala. Another significant step on the practitioner part is to reach out to the religious scholars. For that, I will just mention in slides different melodies of the nafs which we identified. However, one of our PhD students, he is working on this, and we are trying to have an inventory for this melodies of the nafs. And inshallah, in future we will have an inventory on which we can assess these melodies of the nerves. I mentioned another significant step on the practitioner part is to reach out to the religious scholars to acquire basic knowledge of religious practices and prayers and need to expand their consultative model. However, some questions or queries may be better to refer to religious scholars and to keep liaison with them in order to understand a range of religious traditions in the local community and the possibility to develop a referral pathway to bring religion and mental health into closer alignment. A concrete techniques grounded in religious and spiritual tradition may be used to affect specific aspects of consciousness, such as prayers, tools for strengthening beliefs, purification ritual, self-observation, and practice of developing and maintaining calmness in difficult as well as excited situations. There are some thorny ethical and professional issues which makes the spiritual understanding of mental illnesses distinctive from the traditional mental health approaches and emerge as a challenge for us, which I think to be discussed in different such. These were few things I mentioned, and I think that if there is any question regarding these thoughts, then you are most welcome, and then you can ask the question, and I will try my best to answer those questions. Thank you. So nice of you.